So good afternoon and welcome to this webinar. It is on preeclampsia and what you need to know. So we're going to go ahead and get started just to make sure I'm conscious of people's time. I appreciate everyone joining. Again, this is being recorded, so if you're unable to stay for the whole thing or if you enter late, it will be made available, I believe, within 24 hours on the website. There'll be a link available for that. That said, let me share my screen. Let me do this. Let me see if this works. Nope, that didn't work how I wanted it to. Okay. Apologies, technology is not my favorite thing. There we go. Okay. So if you have questions, feel free to either raise your hand or go ahead and put it in the chat. I will let you know I cannot see the chat while I've got the PowerPoint going, but feel free to interrupt or I'll answer your questions at the end. Yep. Okay. So just to go over what I hope for us to accomplish during this time together is just a little discussion, and so that you'll be able to tell what preeclampsia is, some of the risk factors for preeclampsia, explain some signs and symptoms, know the ways that it can affect you and your baby, and understand how preeclampsia can be diagnosed and treated. And if you're not expecting yourself, but you know someone, this is also still very valuable information, and you can share it with a loved one or a friend, family member. So just a little introduction about me, because I think sometimes it is beneficial if you kind of know who's talking to you and what their background is. So I am originally from upstate New York. It's kind of is what it's looking like up there. Actually, it probably doesn't look that good now. The leaves are all gone. But I am a daughter, sister, aunt, mother, grandmother, all those good things. I am a nurse, and I've been a nurse for over 35 years now. My primary areas of focus are medical, orthopedics, rehab, mostly inpatient rehab, pediatric home health, managed care, quality education, and hospice. So no, I am not an OB nurse. That is not my area of specialty. However, as I said, I do have 4 children of my own. I am a grandma. So I do have a little bit of experience about that. And I have also done education on maternal child as well. So let's start with what is preeclampsia. Second. There we go. There we go. So preeclampsia is a complication of pregnancy. Worldwide, statistically, 2 to 8% of all pregnancies have complications to them. And in countries unlike ours, third world countries and those without better medical care, unfortunately, there's like 50,000 maternal deaths, and there could be up to 500,000 fetal deaths. Again, being in the United States, this is not our statistic. Ours is much less than that. In the US, it's only about 1 in 25 pregnancies, or about 5 to 7%. And we usually catch it much sooner, so we don't have the morbidities and things that other countries might. But what it primarily is the blood pressure starts to go up in the mom. They'll see protein and things in their urine. So that shows that sometimes it can be some kidney damage. There's some other signs for other organs. Usually doesn't happen until about halfway through the pregnancy. So when mom's about 20 weeks along. And this is when a person with normal blood pressure. If someone already has a pre-existing condition of high blood pressure, they're going to be monitored a little bit differently and more closely just to make sure that there's no changes or fluctuations in their blood pressure. But in someone who has a normal blood pressure, but all of a sudden about halfway through the pregnancy, it starts to go up, they're going to kind of be watched and monitored a little bit more. If it's not treated, if it's ignored, if moms aren't going for their prenatal visits, it can be fatal for mom and or baby. Okay, so what are some of the risk factors? I kind of mentioned a little bit. Let's go into depth a little bit more about some of the risk factors. First and foremost, just to let everyone know, there is no real specific known cause for preeclampsia. They've done some studies. There's only like 2 that I've been able to find that had any sort of merit to them, where they've done like a little extra research and things to it that are looking at like DNA and some other possibilities, but there's nothing concrete out there and to really confirm why it happens. It just happens. You know, a mom's got something, a major change in their body and their flow because there's another person there or persons. And that's, you know, sometimes their body won't react quite how we want and takes on that a little extra stress. So some moderate risks that can happen, or moderate things that for risk factors, sorry. First of all, if it's a first pregnancy with a current partner, just because, like I just mentioned, it's a change in our body. Okay, it's an interruption in our regular flow. It does add stress to the body. So sometimes just that's how the body will react. If a person is obese before they become pregnant, if there's a family history, so if, you know, a mom or sister or even maybe cousins or something like that had preeclampsia, it's a little sign that you may just want to be watched and monitored a little bit because it can run in the family. If a person is over the age of 35, it increases the risk for preeclampsia. Anyone over the age of 35, though I know most of us when we're 35 don't really feel like we're really aged that much, but for women having babies over the age of 35, the risk factors for many things increase, and preeclampsia happens to also be one of them. If you had a complication with a previous pregnancy, that of course will increase your risk. And then if you've got pregnancies that are 10 years apart, so say you had baby number 1 and number 2 and you were 22 and now you're having baby number 3 and you're 32, 33, it's almost like a brand new thing happening to your body. So that will increase your risk factors. Oops, sorry, double click there. So some higher risk factors for an individual is if you've had a pregnancy before and you had preeclampsia. So that, of course, that alerts the doctors that, you know, normally women go just once a month during pregnancy and don't start doing that every other week or so until, you know, maybe 6 months of pregnancy. Well, you may start that a little bit sooner if you've had a history of preeclampsia. If you're having multiple births, you know, twins, triplets, quadruplets, whatever, you know, there's 2 beings in there instead of just one. So of course that increases some of this additional stress because you're, you know, offering nutrition and viability and things to more than one baby. If you have high blood pressure before you even get pregnant, it's already a predisposed condition that you have. That, of course, is going to increase your risk to getting preeclampsia. So you're going to be monitored a little bit more frequently just to make sure your blood pressure is staying where it needs to be. If you're diabetic, have chronic kidney disease, have an autoimmune disorder such as lupus, because you've already got stress on your body, that will tend to increase your risk. Those make you a little bit higher risk factor for preeclampsia. So we would try to make sure that we're monitoring all those things before we get started. And then if this is an in vitro fertilization, just because your body didn't go through some of the normal cycle and the normal process in getting pregnant, you were assisted, which is absolutely fine and wonderful. But because it didn't happen 100% naturally, that can give you a higher risk of getting preeclamptic. Another risk factor is if you happen to be a Black woman versus a white woman, the risk factor increases by 60%. Exactly why? Unless it's, family history, predisposition to having high blood pressure, it's just another risk factor, unfortunately. So you just make sure you go to your prenatal visits and it gets watched and monitored, so you don't have to worry about that. Okay, some signs and symptoms, because everybody's always like, well, how do I know if this is going to be a problem for me? This is something that is going to be an issue. Well, this is why we go to our prenatal visits and make sure that we're getting watched and monitored. But there are some physical signs that a person will have or potentially have if they are becoming a potential person with preeclampsia. Okay, now the things on this list that have little stars by them, those are the most common things that will happen if a person is having signs and symptoms of preeclampsia. And the thing you also have to watch out for is some of these things. So I'm going to jump around just a little bit and talk about some of these things with the asterisks first. Okay, so if you notice, one of them says nausea, vomiting, and or dizziness. Now we know that a lot of times with pregnancy, we have the morning sickness with nausea and vomiting. Now remember what I said in the beginning, with preeclampsia, it doesn't usually show up until after 20 weeks of pregnancy. Usually, if a woman is lucky, the morning sickness will stop after the first trimester, and that is about 12 weeks of pregnancy. So if you start having, you had morning sickness, the morning sickness went away, and all of a sudden you're starting to feel nausea and you're starting to vomit again, well, that might be a sign you might want to make a call to your healthcare provider and say, hey, look, I've noticed a change. What do we need to do? Okay. Headache that doesn't stop. I mean, we all know with this lovely Texas weather that we get prone to headaches when it gets cloudy or it gets extra dry and allergies start to bother us and things like that. Well, this is a headache that you get and you've had it for over a day, or it's going into a second day. So that's something you might want to contact the doctor and alert the doctor or healthcare provider about. Swelling in your legs, hands, and feet and face. And we know some of that comes along with pregnancy. You get the swollen legs and ankles. Well, if you notice that it's not just your legs and ankles that you're noting some new or additional swelling in your hands and face, you want to make sure you keep aware of that. If you have a sudden increase in your blood pressure, you go into the doctor's office once for one of your regular routine visits and your blood pressure's up, they may have you come back to have it monitored again just to make sure. Okay. Let's see. So we'll go back a little bit. So if you may have some visual changes, and this kind of goes with the fact that people that have high blood pressure will tend to have a few of these symptoms that I've mentioned. So that it's kind of a warning that maybe your blood pressure is going up, but because you're pregnant, usually it's diagnosed as preeclampsia. Okay, so when blood pressure goes up, you get the headaches, but you may also get some visual changes, some blurriness. You might see spots or flashing lights. So any type of visual changes that you might notice, you might want to contact your healthcare provider. You could begin to have some pain in your upper belly or shoulder, and it's usually on the right-hand side. Or if you start having trouble breathing or some shortness of breath. Now we know a little shortness of breath might happen as you get bigger and bigger, just because of the baby on the diaphragm does sometimes make us a little short of breath. But if it's concerning or new, or you have any questions about it whatsoever, contact your healthcare provider. Okay. We don't want any symptoms to not go noted. Okay. Especially because they can get worse. So we want to make sure when they start, it gets noted. Also, during your routine visits, this is why you get your urine checked, is to make sure there's no protein in your urine. If they see protein in your urine, could be a little bit of a sign of some problems with your kidneys, which is sometimes a sign of preeclampsia. They'll check your blood to make sure that there's not changes in the liver enzymes or in the platelets. And when some of those things happen, when the platelets go down, the liver enzymes go up, that's kind of what the HELP syndrome stands for. Okay, it's, the elevated liver enzymes, lower platelet count. So we always are wanting to make sure that, red blood cells aren't getting hurt or damaged. So that's why they do so many blood tests. It's not just because they like to think that we're pinfishes. Okay. So this is just a nice little diagram that's done by the March of Dimes for signs and symptoms of preeclampsia. You can just go on the March of Dimes website and they have it readily available for you. But it's a visual, because I know sometimes just reading lists is kind of monotonous, and it's better sometimes to have a picture to help you. So it goes over and it shows, where about headaches about not going away, some changes in your vision. Right. You can also become sensitive to light. So it's not just that you're blurry or having spots, but all of a sudden you notice a little sensitivity to the light, which could also be related to having the headache. Okay. Some trouble breathing. You'll have some pain in your belly on the right side. Again, severe nausea or vomiting. Another thing is rapid weight gain, and I don't think I mentioned that on the list. And we expect someone who is expecting to have weight gain, but this is 2 to 5 pounds in a week. Even the last month, which is mostly when baby's growing and things, there's usually a half to a pound of weight gain those last 4 weeks, but not 2 to 5. That's too much in 1 week. So that's why, you're making sure that you're getting weighed every week or every time that you go to the physician's office so that they can monitor. In the beginning of your pregnancy is to make sure you're not losing too much weight from morning sickness. At the halfway mark and on, it's to make sure that baby's still growing, but you're not gaining extra weight that you shouldn't be. And then, of course, it shows us pictures. If you are expecting and have not received, we do have a flyer that we can send out. So if you want to contact me, and at the end I have my email and things. And if you didn't get one of these flyers, which is, are you at risk for developing preeclampsia? It kind of goes over some of the things that I've just mentioned. It has slightly different pictures and things. And of course, it mentions the HELP syndrome that I talked about, where, your liver levels may go up. Talks about protein in the urine because of some kidney damage. So if you haven't gotten one, please let me know, and I'll be very happy to make sure that you get one sent to you. We're trying to make sure we do send it to any of our expectant mothers, but if you happen to not be a member of Parkland Community Health Plan, please let me know, reach out, and we'll be happy to send you one to make sure you get one too, even if you're not a health plan member. We have no problem sharing. We enjoy sharing. Okay, so the effects. I've kind of touched on this a little bit. If you don't get preeclampsia diagnosed and treated in a timely manner, some things that can happen are such as kidney, liver, and brain damage. As mentioned, we talked about how your liver functions, the blood that they check, and then your kidney functions. They can lead to long-term kidney problems in moms. So we want to make sure that we're getting these checked so that there isn't another problem with them. Some other things that can happen is blood clots. Things aren't flowing right. We already know that because your blood pressure is going up. So we want to make sure that you don't get any blood clots. We want to make sure that's being watched and checked. You can get what is called eclampsia or seizures. Now, just to give a little bit of differentiation between, what's the difference between preeclampsia and eclampsia. And I know it's kind of confusing because sometimes they kind of get used, they'll flip-flop the words and not really have a clear definition. So with preeclampsia, as I noticed, it's the high blood pressure, it's the extra swelling, protein in the urine. Does not normally, not that it can't, of course, happen before, but usually happens between the 20th week of your pregnancy or it could happen up to the first postpartum week, so like up to a week after you deliver, because your body's just gone through another shock of delivering the baby. Okay, so you can even have preeclampsia after delivery. So that's why you'll be checked sometimes really quick after the baby's born, and then be expected to go back even an additional time after delivery just to make sure everything's fine. Eclampsia, on the other hand, develops when you've had undiagnosed preeclampsia, and it can lead to convulsive seizures or even coma, um, with no real known time frame. So that's why, it's very, very, very important that you make sure you go to your prenatal visits. Another problem is stroke. Well, we know that if someone has high blood pressure, it can lead to a stroke. So with preeclampsia, your blood pressure is elevated, it can also lead to a stroke. It can also increase your chances and possibilities of having other diseases such as heart disease, diabetes, and kidney disease later in life, because you've already had a little bit of damage because you've had the preeclampsia. Okay, so that's something that you want to make sure to have monitored and watched. Okay, so now baby, what can happen to our baby if we get preeclampsia? Well, we can have a preterm birth, and preterm births are defined, as before 37 weeks. Okay, babies we know nowadays are viable. I mean, I think I've heard baby being born as much as 23 weeks gestation. That now they end up in the hospital for a very, very long time, can very potentially have complications. But we prefer babies be born after 37 weeks because everything's developed the best, and they have less problems after delivery if they make it 37 weeks or more. So with preeclampsia, because of the complications, they could be born early. They can have what's called a placenta abruption, which means the placenta separates from the uterus, either completely or partly. And the concern with that is we know that the placenta nourishes our baby, and it's connected to the uterus. So if it ends up separating from the uterus, it's not going to get the vitamins and minerals that it needs to give to our baby to keep our baby nice and healthy. Okay. Also low birth weight. And low birth weight is defined as 5.5 pounds or 2,500 grams or less at time of delivery. Babies can definitely survive if they're born at lower birth weights, but they're just much healthier if they're at least 5.5 pounds or more. Okay. And then there can be postpartum hemorrhage, which is bleeding. Especially that will happen if the placenta abruption has happened because it's already partially separated, so it can cause some additional bleeding afterwards. Okay, so diagnosing and treating preeclampsia. So one of the things that they do is they do a blood pressure check during every visit. And now maybe, some people wonder why they do some of the things that they do. So one of the reasons they check the blood pressure is just to make sure that it's maintaining normal for the mom. Okay. Then they can do the urine dipsticks, which they do during every visit. And that's checking to make sure that there's no protein in the urine. Because remember, as mentioned, one of the signs is protein in the urine. Protein in the urine can later on lead to kidney problems. So they check it every visit. They start right away. So there's no chance that they're going to forget or miss. This way they don't have to worry how far along you are or are not. They're going to catch it, and they're going to catch it quickly. Blood tests to check the levels. Now they don't do blood tests necessarily every single visit, but they have it scattered throughout to make sure with the timing of when people are at the most risks of getting preeclampsia. But that's why one of the reasons why they'll do some of the extra blood work that they do. It can also be diagnosed sometimes with a ultrasound, especially if the placenta is starting to break away from the uterus. That placenta abruption. They can see that. They can do non-stress tests, which checks the baby's heart rate. And they can do what's called a biophysical profile, which is taking the combination of the non-stress test for baby and their ultrasound, and then see how things are going for that, and be able to define it or diagnose it quickly. Okay. Whoops, a daisy. Sorry about that. Go backwards. Okay, so treatment of preeclampsia. So we keep doing our regular prenatal visits. We get diagnosed with possible preeclampsia. So they're just going to keep doing the regular checks and regular blood pressure. If they're concerned, then what they can do is they'll start having you come in a little bit more often, or they may have you do your blood pressure at home. Okay, blood pressure monitors are very inexpensive, and a lot of times if you get diagnosed with preeclampsia, we're very happy to make sure that someone gets a blood pressure monitor so they can keep making sure that they're checking their blood pressure daily, and checking it maybe a couple of different times during the day. Now, the doctor or healthcare provider may also have you come in more frequently, which I know is never anyone's favorite thing to do, but it's much better to be safe than sorry later. So instead of maybe coming weekly or every other week, they may have you come twice a week. Okay. Let's see, you'll be asked to monitor baby movement. And of course, once baby gets bigger, the movement does decrease because there's not as much room in there, but they're still gonna, want you to make sure you're following along and making sure baby's moving like they expect the baby to do. There is another urine test that they can do, which is called a 24-hour, which checks your protein. You can do it at home. It's a little bit of a nuisance if the doctor asks you to do it, because you have to, make sure every time you go use the restroom that it gets dumped into the container gets kept on ice. But it's very vital that if they have any concerns, that it gets done and the directions are followed accurately to make sure you've got the best results. And the doctor or healthcare provider's office will explain everything if you need to have that done. Let's see, did I touch everything? Oh, and possibly, which of course is everyone's most dreaded thought, is that you get stuck going into the hospital for a little while before the baby is actually due. That's if the blood pressure is way too high and they want to make sure that they can monitor it and possibly give medications. And because it's you and baby they want to monitor and keep track of, we can't always monitor baby as well at home as we can in the hospital. And they can do little monitor checks and things on the baby if you're in the hospital. And then at the absolute worst case scenario, they may recommend early delivery. And they, of course, are not going to do that unless they're pretty positive, which I'm going to say this day and age, healthcare providers are pretty accurate. They aren't God, if you believe in that. So, but they'll just deliver when they're sure that baby's stable and you're going to be safe too. Okay. And the thing is that they do have to deliver early, like even before that's 37 weeks. With the way things are today, like I said, the viability of a baby born at even 30 weeks is much greater than it used to be. Okay. Okay, so just a quick recap, some of the information we went over. You want to make sure that you're watching for signs and symptoms of preeclampsia. So that whole list of things that I mentioned, as well as the ones that were on the picture that the March of Dimes has. So you're watching for changes in vision and headaches. If you have a change with your nausea and vomiting, you want to keep all your scheduled appointments. You don't want to miss a prenatal appointment unless it's absolutely positively necessary, and then you want to, of course, reschedule it and get back in there as soon as possible, because you want to make sure you and baby stay safe and have the best possible outcomes. You want to watch your diet and exercise. So if you're starting to have any problems with swelling and things, of course, you want to do things like avoid salt. All right. The thing with exercise, if you've not been doing a very aggressive exercise program, this is not the time to start something aggressively. Nice walks, some gentle stretches maybe. Make sure you discuss it with your healthcare provider. But if you've never been a runner, you don't want to start running. But if you have been, I had a coworker one time that she always ran like 5 miles at least every other day. Well, as long as she felt up to it, as long as her physician felt it was still safe, she actually, I think, ran up until 2 days before she delivered. Now most of us aren't going to do that, but you don't want to just all of a sudden become sedentary, just sitting down and not doing anything. You want to continue moving around. And again, like I said, watching your diet and your sodium intake, how much salt and things like that you're eating. If you have any questions, any concerns, anything that makes you nervous, call your healthcare provider. Okay, stay in contact with them. If you don't even talk, if you do see an actual physician, then versus a nurse midwife, nurse midwives usually answer their own phones. Doctors sometimes will have office staff that will assist them, but someone will be able to answer your question or have someone call you. You should never be afraid to contact your healthcare provider with even the littlest of things, especially they understand if this is a first baby for someone that you're going to possibly be calling maybe a little bit more than someone that's had 2 or 3 children. Okay. And let's see. And then here's my references. I do tend to use the CDC, March of Dimes, known national type resources. Are there any questions or concerns? And this is how we want all babies to come out, all smiley or sleepy. If no questions, okay. I want to thank you very much for coming and participating in this webinar. Congratulations if you're an expectant mom or support person. Again, here's my email if you have any questions or if you need one of those flyers because you didn't get one for whatever reason. If you are a member, I also provided the member service phone number as well as the one for Kids First, which is our CHIP and CHIP Parenate. I'll leave this here for just one moment, so if you wanted to write them down. We stop sharing. There we go. Okay. And again, thank you very much. Again, this has been recorded and it will be posted on our website, or at least a link will be posted on our website. And I hope everyone has a wonderful afternoon. Thank you very much.